right, good morning, everybody. I can. I just want to make sure that people can hear me. So maybe, Wason, can you give me a one? You can hear me. Good. So that way, I know that you can all see me and Zoom. Anyway, good morning. It's so nice to have you folks joining us on the webinar again. Today's webinar will be very important because talk about hypertension. Why I say that is because a lot of people don't understand hypertension. And matter of fact, majority of people, until they really start getting sign and symptom, then they see, oh, wow, I have a hypertension. And matter of fact, I have a lot of the patients who come back to talk to me. Many of them also found out hypertension was a surprise. Also, they usually has two things they will find out first. One is they also say, hey, you know what? The doctor told me my cholesterol is going up. And usually the LDL cholesterol goes up. Secondly, while they're doing that, they also start realizing, hey, you know what? My blood pressure also going up. Now, beforehand, a lot of people don't realize blood pressure can be not as before where you have 140 and up, and then 90 and up. The actually, interestingly, is they actually tighten the scales. Now is, and later on we'll talk about it, because if you're above 130, you already risk of hypertension. And a lot of the people actually came back to see me. Their blood pressure go as high as, excuse me a second. Okay, hold on. Okay, I just want to double check. Can someone give me a one just to make sure that you can hear me correctly? I'm just concerned that you cannot hear me. So maybe Wason, can you just give me a one? So, okay, you can hear me, good. Okay, thank you, good. So let me continue my story. So a lot of the customer come back and they say, hey, you know, my blood pressure is now 160, but I don't feel anything. I'm okay, perfectly okay. But because they went to the doctor, start seeing the cholesterol LDL usually going up. And the LDL going up is usually in a range of already like 135 and above, or somewhere around there, which they need to come down. And so the doctor would say, hey, you know, blood pressure going up, you got to, you know, do something. Like, for example, maybe you start either control your diet, exercise. If you don't, I got to give you medication. And that is always the case that start off. And the hypertension, also because they now get to 160 range of the systolic blood pressure, then the doctors also say, hey, you know, you are actually in a fairly good risk. You might need to really start off your anti-hypertension medication. So like Norvac or this type of medication. And so they will be really start working with you to blow the two, cholesterol and blood pressure. And you know what? The third stage, actually, you become a pre-diabetic, because when you measure A1C, usually A1C was up. So that's why today's lecture will give you a general picture why you're having this issue and give you a lot more understanding. So that way you can work with your doctor, your team, your healthcare provider. So you will really understand what is hypertension for you and how can you manage it. 各位朋友，我係 Angela Lowsutea President 你好。嗱，好高興啊！今日咧係大家都有機會去聽下咩叫做血壓高啦。咁其實好多人咧我其實好，依家都好多病人翻嚟咧，即係佢話俾你 Angela，我血壓高喎，或者話係 accidentally 揾到佢係血壓高嘅，即係好多人都唔知道點解會血壓高，亦都冇個感受。因為佢血壓高多數係冇乜跡象嘅，但係去160都未必有跡象喎，嗰度有問題喎。咁變咗嚟講，好多時咧就係去度咧，就度到膽固醇高啦，第二日血壓高啦。咁依家都解釋下點解會咁樣落嚟嘅。咁當你有咗呢樣嘢嘅時候咧，你就會開始醫生就話：喂，你要食血壓丸、膽固醇丸，同埋咧可能你就已經係去緊前期患病嘅象徵。咁所以變咗嚟講咧。呢個係一定要開始了解同埋點去控制，咁其實呢個係好好嘅。當你有呢啲咁東西 information 嘅時候咧，你就好快脆咧 有一個 understanding 啦，知道點做啦。咁我今日開始咧就喺呢方面咧開始解釋，同埋咧幫助你咧多啲了解。咁我就會現在咧喺我嘅 screen sharing 嗰度開始睇我哋 slide 啦。I hope everybody able to see the slide. If you can, maybe you can give me a 1 or so. And for the Facebook people, can you give me a 2? So that way I know that you can see the slides. Okay, Facebook. 如果各位朋友睇到1咧就 OK 啦。最緊要2嗰度咧喺 Facebook 睇到live screening 咧俾個，如果你俾到一個即係 like 我啊，咁變咗我最低限度知道你哋已經係做緊，可以見到我嘅video 啦。OK。So today's topic is understand your risk for high blood pressure. Now today I have a lot of new customers also in the webinar where people from all over the world, from basically from USA, Canada, also from Hawaii, Hong Kong. So quite a bit of people. So maybe I take about 5 to 10 minutes just to get you update what we're talking about. And when you link up together, then you have a very good understanding what is mean hypertension. Okay. All right. Now, today we will able to cover several things. We're going to give you what is an overview of hypertension, what it is, what is prevalence to pre-diabetic diabetes, what is a symptom of hypertension. Now, very important, you got to start understanding what a symptom of hypertension is going to be and how to manage this symptom and what's the cause. And so you can understand it. And maybe you also need to change your lifestyle, which is easy to do. And then at the end of the day, you got how you can continue to maintain good blood pressure so you will not get into all kind of blood pressure complication. So today, that's what we'll talk about. It's a very good topic. It's a common topic. A lot of people actually will have that issue. And we are here to help you to basically prevent a lot of the disease that will be, a lot of the health complication can be prevented. 嗱，各位朋友，今日咧我係同你講呢幾樣嘢咧係幾好嘅，因為今日我哋好多不同嘅地方人士啦，亦都有美國啦、加拿大啦、香港啦，同埋東南亞國家啦，所以咧其實咧我都有些少去俾多啲資料咧。我其實啲前期嘅朋友咧係未必知道咩叫糖尿病啊，我會多解釋嘅。咁但係今日重要點咧係第一，我哋講下咩叫高血壓同埋糖尿病有咩關係咧？點同埋高血壓嘅症狀係點樣咧？同埋我哋有咩預防咧？同埋仲有咧就係點去改變個生活習慣咧，係能夠即係幫我能夠做到冇高血壓咧。咁最後咧就有啲嘢咧係能夠你記住咧，你能夠你可以 manage 你自己嘅，即係管理呢個高血壓嘅問題嘅。其實好重要嘅，因為高血壓咧係好多時係前期患病者嘅一個重要嘅跡象。OK， so I will spend a few minutes just real fast talk about how do you get to diabetic. Okay, now why I want to continue repeating that, the reason is a lot of people don't really have that understanding, but you know, if once you understand it, that you can be much more encouraged how to manage not getting yourself into pre-diabetic and not getting yourself to be diabetes. But even you get yourself in diabetic, no problem. We can help you reverse back to the area where you get pre-diabetic stage. So we saw a lot of patients that working with us able to do that, and that is wonderful. So that way they will not develop all kind of complications. Now, the first, you have 4 stages. Everybody go through this 4 stages. Basically, stage 1 is your LDL cholesterol goes up, and then that result it damage the B cells that come out from the pancreas, that which take the B cells and will take the sugar into the cell. So damage, so more B cell coming, but our sugar is not going to the cell because the B cell is damaged. Your blood sugar start going up. When that happens, you know what? Blood sugar and LDL cholesterol mix together, your blood becomes thick. And that is the real problem, because when it becomes thick, it starts forming plaques everywhere, the whole body, your stage 2 incoming line. That's related to your hypertension. Because what happened is all these plaques form to vessels everywhere, your whole body, your brain, your heart, anywhere. And then, you know what? You have less space, your blood pressure is start going up. Your sugar, cholesterol, blood becomes thick, you're forming plaque, everywhere. In a few years later, you're going to have blood clot everywhere. So net result, your blood pressure go up. That's stage 2. Now, if you have not changed anything, you know what? Your blood blood sugar continue goes up, and then you will real fastly move into the stage 3, which is your pre-diabetic symptoms start coming in. Well, the doctor is going to measure one thing called an A1C, hemoglobin A1C. HbA1c is the common name. Now, when you have HbA1c, the measure is the measured amount of percentage of sugar attached to this hemoglobin cells. So if you are under 5.7, you're a normal person. If you're over 5.7, 6.4, you know what? You are a a pre-diabetic person. If you don't do anything, most likely in 3 years, you will change the diabetic, will be anything over 6.4, you're diabetic. So if you go up to 7, medication will be coming for permanently. So you really got to take steps to yourself to manage this. Don't get yourself in pre-diabetic. Even you get a pre-diabetic, you make sure get yourself back to the normal range of 5.7 A1C. If you have diabetes already, no problem. We'll help you get all the way down to below 6.4. And that will be your objective. So keep that in mind, and I think it can be done. You can do it. 嗱，各位同學，因為今日好多朋友啦，係有不同地方嚟啊，夏威夷又有啦，美國啊、加拿大啊、東南亞國家啦，咁我 spend 多少時間咧講講咧，係呢個4個 stage 嘅點樣去由即係高膽固醇、血壓，然後去到前期患病到糖尿病。嗱，第一個 stage 咧就係啲糖咧上升上嚟啦，同埋你膽固醇都上升啦。點解會咁咧？膽固醇上升嘅時候咧，就 damage 嗰啲損壞嗰啲 B cell， 由胰島素嚟啲 B cell 帶啲糖入去細胞裏面嘅。當你壞咗咁多，越多 B cell 出嚟咧，就越帶唔到糖入去啊。咁你血糖加埋你個膽固醇咧，就會一路係咁上升咧。咁將啲血咧就令到好結啊。最大問題係糖尿病就咁出嚟㗎啦。呢個咧就變咗擺到全個身體血管裏邊咧，就開始form 咗呢個 plaque 板塊啦。咁你個位置咧，每一個血管嘅位置越整越窄咯，窄咗嘅時候咧，你血壓會上升啦。咁你血壓上升嘅時候咧，就呢個係 stage 2嘅。咁變咗嚟講咧，好快脆咧，你糖繼續高啦，你亦都唔改變生活習慣啦，咁好快脆咧去 stage 3啊。嗱 stage 3咧就每一個醫生咧都開始度呢樣嘢，叫做 hemoglobin A1C、HbA1c。嗱 HbA1c 咧係度你幾多個 percent 嘅糖黐咗喺呢個紅血球嗰度呢個 hemoglobin 度。咁紅血球你5.7以下咧，你係 normal person。如果5.7至6.4咧，你係前期患病。咁當你如果過咗6.4之後咧，3年後如果你咩都唔做，多數你要轉㗎。咁轉咗之後點啊？咁你有糖尿病咪者咯。到你以後即係你醫生都俾時間你睇改唔改啦。改唔到咧，咁你以後變咗糖尿病者。咁希望咧，我哋依家係早一啲，係同你搞掂咗呢樣嘢。唔會俾你跌落去個前期患病，就算前期患病，我都希望你能夠俾你早啲去做好多 life 即係生活習慣改變啊，食嘢改變啊 exercise 啊，咁你咧就唔會變咗係一個糖尿患病者。咁呢個如果做到咧，哇，大家都開心啦 ，OK？ So I hope that will all basically help you to basically get your A1C below 6.4. Even though you are pre-diabetic, we want to get you off the pre-diabetic chart. If you have diabetes, we'll get you back to 6.4 or below. Wow, then you'll be very happy because of the fact that your health definitely improved. So how can we help? Basically, we actually have this product called Lowsutea. Lowsutea is very simple. There's 2 products in there. One is called guava leaves, which is delay the absorption of blood sugar into the gut blood vessels, so you less sugar into the vessel. Second, bitter melon is increase the insulin sensitivity, take sugar into the cells, and also you take sugar, cholesterol, and sodium out of the urine. When that happens, you know what? Your 3 high will decrease. You know, your sugar will go down, your cholesterol will go down, your blood pressure go down because your salt will remove. So you will decrease your blood pressure. So net result, 3 high will come down. Wow, that's really wonderful. That's basically what we do. 你啲朋友就問啦，喂，咁其實點幫助你㗎？飲虛糖茶係有一個好特別嘅功效嘅。第一，你係飲咗，因為快食啊，將啲糖咧 delay 咗佢入去個血嘅腸嘅血管裏邊，咁你少啲糖喺血管裏邊咯。咁但係咧苦瓜嘅好處咧，佢就增加胰島素嘅敏感度，咁就加翻啲糖咧入去細胞度，咁啲糖有細胞入邊㗎，有 energy 啦。仲有如果 excess 咗多咗出嚟點啊？喺尿嗰度掉咗出嚟，膽固醇掉咗出嚟，仲有最好咧就係佢連埋嗰啲鹽都掉埋出嚟。當一跌鹽掉出嚟，血壓就會降低。咁你三高都降低到 ，so perfect. So it's really good. Now, on top of that, our company is not only just to say, hey, drink the tea, because we have also an active program with 5 programs continue to help you and holding your hand throughout this journey to continue make you good health. Well, what's that mean? Well, first of all, we'll teach you about dieting, drinking Lowsutea, how to drink Lowsutea, help you lower blood sugar, how to get you to eat low carb diet and also low fat diet. We have a lot of webinar in the YouTube you can actually listen. Secondly, we teach you about exercise. Now, every day you do about 10,000 steps and you do 150 minutes in a week of exercise and basically walk very easily, easy to do. And also we'll get you to learn about weight control, how to lower your weight. And so you can make yourself, even your 30 BMI, go down to 23. If you lose 10% of your weight, you know what? Your A1C drop 1 point, meaning that if your A1C is 9, you drop down to 8 or 7. You drop down to close to 6, which is wonderful, right? And then you also, we have weekly webinar like today, you hear that. Plus we help you to teach you how to track your blood sugar. You can put a finger and we have charts to help you to basically allow you to understand how to track your blood sugar and also write down the weight, the food you take. Wow, you have a system now for you, okay? So that's what we'll do. And hopefully what we'll try to do is lower your A1C, as we mentioned, all the way down to hopefully 5.7. You might say, wow, you know, how can I am? You know, I'm already diabetic for, 10 years. Well, you know what? I do have patients now can get themselves down to as good as 5.7. Some was 5.8, some are just below 6, but it's okay as long as they're at that range. Keep trying now, but they need to work on it because they need to exercise, diet, and also, their control weight. And when they did all that, they were able to drive it down. Certainly, sometimes they also require some medication, but I saw it with my own eye. They could actually get down to 5.7. Okay? 各位朋友，我哋唔係話淨係俾茶飲就算啦，我哋仲有一樣嘢，有5個節目咧，係幫助你一齊去努力咧，係將你啲糖咧係 A1C 降低到 5.7 嘅。咁其實點樣做啊？咁就食嘢啦，我教你點食啦，教你點去降低血糖啊嘅膽固醇啊，同埋食啲唔係肥嘅嘢啊，咁教你點樣會運動啊，每日8至1萬步啊，同埋磅重嘅管理啊，有最緊要你 BMI 咧係要跌到即係23以下，或者聽我哋每個禮拜嘅講座啊，仲有咧我哋每日係量度到咧呢個咩你血糖點樣，咁我哋可以測嚟做到呢樣嘢。咁希望咧，由呢個方面嚟講咧，即係有一啲鼓勵性，同埋咧有啲仲係知識俾到你咧，係點去管理嘅糖尿病嘅。So if you don't do anything, what's going to happen? Now, this is going to be sad because you really has a high risk of stroke, cataract, with the eye. You got a loss of memory, and also you might injection, risk of heart attack. Nerve damage, because remember the blood will clot everywhere, including nerve. So you're going to have stomach problem, you cannot feel, your high blood pressure, your vessel become hardened, so you can have stroke. And if you don't feel, you hurt yourself, you don't get healed, so you're going to cut off your foot because of gangrene, and then you damage your kidney because your kidney vessels are all plugged up. So you end up with dialysis. 70% of patients require some kind of kidney disease. Plus, your pregnancy complication, your gestation diabetes, most likely you're going to have a diabetes as time goes on. And 30% of our patients doesn't have that sex life because they can't feel. Okay, so it's very sad. So you don't want to be in that stage. Hopefully, that with what we taught you, you never move into that. That would be wonderful. Okay, 嗱，各位朋友。記住，當你係 如果唔去管理嘅時候咧，你個併發症係好多問題，全身嘅問題。第一好煩啦，呢個就係第一，你會有機會中風啦，你唔記得嘢啦。我相信你有親戚你問想話阿仔食咗飯未啊？晚17次5分鐘後，哇！其實呢個唔關佢事，因為佢腦都唔記得咗，睇唔記得個 short term memory 因為塞咗嘛。咁所以變咗嚟講，好多呢個問題嘅。仲有咧就係、是、你眼咧係有呢個青光眼啊、白內障啊，呢個亦都有好多呢個朋友出現嘅。咁你胰島素打胰島素啦、心臟病啦，咁同埋咧就神經喺度損壞，因為你塞咗腦啊，好多地方塞咗咧，你感覺唔到，全身嘅嘅神經系統都塞到嘅喎。咁邊樣嚟講咧係會感覺唔到，咁你好多時咧就壞咗，即係整身你又感覺唔到啊，咁你唔處理又發炎啊，咁你就要隻腳都講埋，血壓高啦，講咗啦，咁仲有咧就係會有腎病啦，70% 嘅糖尿病有腎病嘅，咁同埋咧就係懷孕時候咧你有糖尿病咧，以後咧將來個糖尿病係會高嘅，咁性功能咧冇咗，因為你冇感覺啊 ，OK， 所以變咗呢個係一個好慘嘅東西，所以記住我哋希望你唔會落到呢一度。我希望你係前期患病或者糖尿病控制到咧，你冇呢啲併發症，咁我哋就好開心噶啦。So it is our great effort try to help you, not to get you to be really end up with all kind of complication. So we're going to start off our really detail of our explanation how high blood pressure and its prevalence in pre-diabetic diabetes. So you will have a better understanding what is high blood pressure mean to you, and we have a lot of idea about what is a sign and symptom, things like that to give you the whole picture, so you have a really good understanding what is hypertension, especially related to pre-diabetic diabetes. 嗱，今日咧我哋講咗咧就係講高血壓同埋糖尿病前期同埋真正嘅糖尿病、二型糖尿病，佢哋患病嘅人有咩關係咧？我今日就開始講佢嘅東西啦 ，OK？ Now, first of all, you might ask, well, what is high blood pressure? Okay, high blood pressure basically is very simple. It's meaning that commonly you just basically the blood pressure is about a normal range, and we'll talk about normal range in a little while. And basically, if you continue to have this high blood pressure with normal range, which could lead to all sort of blood vessel damage, and also increase many serious a health problem like stroke, or heart attack, all that is, and also even kidney failure, all that is due to high blood pressure damage. Meaning that if the blood pressure continues to be high, your blood vessels in the kidney will basically hardening and no longer filtrate. Then you're going to end up kidney failure and you need dialysis. Wow, imagine you need to go dialysis, either hemodialysis or CAPD. Both of them, you don't want in there. You want to be not involved in your kidney. If you get heart attack, wow, that would be very sad because your heart stopped, you die. Okay, so you don't want to be that too. So basically, high blood pressure can be very sad if you don't manage because stroke is extremely expensive. You cannot walk, you'll be bedridden. Wow, man, I don't want any of our clients to become any of that. So I want to make sure that you have a better understanding what is blood pressure, high blood pressure, tension, OK？ 嗱，各位朋友，高血壓咧係一個常見啲人聽到話，有少高血壓啦，咁其實咧就唔係話好簡單，唔使注重啊。因為如果你真係好高血壓嘅時候咧，你有機會中風喎，有心臟病喎。如果就係損壞你個腎喎，腎功能壞咗之後你洗腎喎，咁呢啲係全部嚴重健康嘅問題。所以你其實咧，我都唔希望你有呢個樣嘢。因為如果中風嘅時候咧，哇大劑啊！你係瞓床啦，做唔到嘢啦，行唔到啦，你個生活嘅質素係十分降低。第二樣嘢，你 cost 係好高嘅。咁同埋咧，仲有啦，心臟病死咗就玩完㗎咯喎，所以千祈唔好去到心臟啦。如果要洗腎更加麻煩。所以邊樣嚟講咧，我哋希望咧，你要控制到血嘅血壓咧，唔會令到你自己變咗呢樣。So you must say we want to know able to control yourself not to get into hypertension. So next question you will say, what do you mean hypertension? What does that mean? Is that a guideline? Well, here is a guideline. It's important to understand. The normal range of blood pressure is 120 of what they call systolic. is less than 120, meaning that your blood pressure should be, when the systolic blood pressure should be less than 120 mm per Hg. And then diastolic, meaning the residual pressure of the blood vessel should be 80, less than 80. Okay, now basically I have a picture here where you can see it real carefully. What is systolic? What is diastolic? Okay, now basically your blood continue to go to your heart. This is your heart, okay? And then the heart will punch the blood come out, boom, and then this is the blood pressure go up is the systolic, which is less than 120. It go all the way to different capillaries, the whole body, basically. The blood will push it out to the arteries everywhere in the whole body. And then you got to have basically a blood pressure of less than 120 if you're normal. And your residual pressure, because after the heart stop not pumping, your vessel will not collapse. The residual pressure has to be 80, less than 80, okay? So that's how these two easy to understand what is systolic and diastolic. Now, why this is important? But when you elevate it, the blood pressure is now 120, 129, which is mean you are now at risk. This is a risk already starting. So before, this was actually about 140. But now they lower the scale to about 130. So meaning that if your blood pressure go up, your pressure is 120 over 129, you already consider as risk. If you're more than 80, you're also elevated, is all at risk. So basically, now the scale are pretty much, if you're over 130, you already basically, hey, you have an issue. I mean, you already be 120, 129, you're already starting understanding as an issue. Now, if you're over 130, you are actually rating yourself is called hypertension, okay? Meaning this blood pressure when the heart pump is above 130, and then your diastolic is 80 and above, is already considered your hypertension, okay? So this guideline is come out is 2017. A lot of you might say, hey, before my doctor would say that, in the 2003 guideline, basically, if you are within 130, is still just a risk, but if 140 was considered high, but now they lower actually to 130 now, okay? And your diastolic is no longer as called 90, it's high 80, they already consider, hey, you are at risk. So really, this is the scale of today so-called knowledge of many doctors will ask you, hey, you know, your blood pressure is high, we need to check. Now, certainly, everybody need to check the blood pressure. I'll tell you later when the time is best to check the blood pressure. 各位堂友，其實咧高血壓咧，好多人咧其實就120至80咧係低過啊，全部低過。咁就係個心啲血嚟到呢度啦，喺個血管嚟到呢度嘅時候咧，個心一谷出嚟嗰陣時，呢啲咧就係我哋嘅即係我哋嘅血泵出嚟嘅時候。咁呢個就係 systolic 嘅 blood pressure 咧，就係120度嘅，呢度彈上嚟，呢度100谷出嚟。咁呢度咧就去晒全身嘅微絲血管啊，身體都係呢樣嘢出嚟嘅。咁第二當你血係流翻喺個血管裏邊咧，佢唔會全部 collapse 噶嘛。咁佢咧呢個咧就80度。咁其實呢個咧係80度咧係低過80度啊，要低過80度。咁呢個係正常嚟嘅。但係現在因為我哋依家個2017之後咧。佢就話：如果你係由120、129咧，咁你已經係叫偏高噶啦 ，OK？ 如果你係高過80咧，就已經係高噶啦。咁所以變咗嚟其實，現在咧個 scale 係高啲嘅啊。咁但係其實依家舊陣時咧係注重咧就抵壓係下壓嘅，咁但係依家咧其實注重咧係上壓 ，OK？ 記住。咁如果你高血壓咧過咗130度咧，佢已經當你高血壓㗎啦。咁當然啦。又下壓咧係過咗80度，亦都係當你高血壓。最重要係130度呢度。其實好多醫生已經係睇咗呢樣嘢嘅。咁當年喺2003年咧， 就係下壓90度先係叫高，但係依家80度已經係啦 ，OK？ 所以其實同埋咧上壓係140度，但係依家130度，好重要咧，知道個心一谷出嚟嘅時候，哇！咁呢個咧就係呢個係上壓嘅血壓。咁希望咧你哋能夠係控制喺少過120度啦，同埋喺呢個下壓咧少過80度。Now, the sad part is earlier hypertension. Most likely, you have no symptom. Now, matter of fact, I have a lot of patients came back to say, hey, why the doctor tell me that I have to take medication? You know, my blood pressure is only 140 or 150. And some even had 160. They said, I don't have any feeling. I have no problem. Now, really, at the end of the day, yes, usually you have no symptom in the early stage. If you're over 130, 140, no problem. Usually at no early stage. But if you don't take care of it, continue to say the same lifestyle, diet don't change, you don't exercise, that will be a problem. Because as time goes on, this will continue to go up and up and up until one day suddenly you become 200. You don't even feel anything. Then you start saying, oh, I have some headache. Then your symptoms start early, morning headache, light headache, nose bleeding, your heart become irregular. You have found heart palpitation. Your heart go boom, boom, boom. That's called heart palpitation. You start getting blurred vision, sometimes double vision. You start hearing buzzing in your ear. These are a sign that is very, very normal hypertension. Usually, this kind of symptom come up will be about 160 and up. So you're going to have this kind of symptom coming. But don't, when you take a blood pressure, if you say, hey, I don't have any symptom, don't let that fool you, because for early stage, even 140, 150, most likely you don't have symptom, but you don't take care of it, you're going to have a lot of problems a few years later. So gotta work on it right away. Don't delay. It is something that, because it doesn't mean that you have no symptom, doesn't mean you have to take care. You gotta start taking care. Now, but when you have severe hypertension, meaning that you are 180 and up now, then you're going to be actually getting tired, fatigue, okay? Nausea, vomiting. It's getting higher and higher. You got nausea, vomiting. You have shortness of breath because your heart is pumping. You cannot really get all the blood through all the vessels. You just got dizzy. You start getting confused. You're going to start fear, anxiety. You might have chest pain. Your muscles start twitching. All these, actually, you might actually end up, you're going to start going to ER, emergency. You have to go start, get yourself in emergency. Because when you get up to 200 and more, the blood pressure will not drop. You have to have fast medication. And the medication cannot give you right away, it will drop down to low. It doesn't work. Usually you have to gradually, slowly, and they may have to observe you. Because when you have severe hypertension, your risk is going to be, especially at 50 and up, you can have a stroke, you're going to have heart attack, you have all kind of problems. Stroke is a bad problem for you. I have a lot of patients previously when I was ICU nurse. People are over 200, they start getting stroke. And also getting, when they stroke, they came to ICU. So all these you want to prevent, because stroke patient, sad part is that after the stroke get well, they are really physically damaged. So when you have your blood pressure over 140, you don't have signs and symptoms, you have to talk to the doctor, start getting treatment, because pretty soon, if you don't get taken care of, the blood pressure will continue goes up, and that will be very, very sad. So just make sure that you want to take a picture of this, please do, so that way we know this, you have some idea. But remember, early stage hypertension, even 140, 150, you might not feel, okay? No symptom, but doesn't mean that you are okay, okay? 嗱，各位朋友，記住高血壓咧係初期嘅時候咧係冇跡象嘅，就去到14、15係冇跡象嘅，你亦都感覺唔到有任何問題嘅。但係當你去更加高啲嘅時候咧，咁你就開始有起身嘅時候有頭痛啦，有頭暈啦，有時鼻出血啦，同埋咧你覺得個心好唔妥啦， 個心會跳得好乖，嘣嘣嘣嘣去跳啦。咁同埋咧，可能有視力方面咧又開始模糊啦，又睇兩樣嘢啦。咁就耳仔又嗡嗡聲咧，嗱呢啲已經係叫好高，差唔多80啊嗰啲咁嘅嘅問題出現㗎啦。咁其實咧呢啲係一定要處理嘅，就唔可以 delay 嘅嚇。咁你一定要去見醫生啦。但係如果你繼續一路講血壓繼續升上去嘅時候咧，咁你就係嚴重高血壓嘅時候咧，嗱呢啲係會好快脆嘅喎。咁樣咧就會好攰啦，同埋咧會係作悶作嘔啦。咁同埋要氣促睇唔到氣啦，仲有暈壓。咁仲埋咧，仲有感覺好焦慮嘅感覺啊，可能心會痛啦，同埋隻手咧就會即係喐動啊，有震啊、twitching 啊呢啲東西。咁呢啲咧係嚴重嘅，即係話你過咗181啊200咧，咁你咧就應該依家去咩啊？去急症室啦。因為咧，如果你呢個 blood pressure 咧咁高上去嘅時候咧，唔跌落嚟咧，你啲藥咧都唔可以浮一聲跌落嚟嘅，佢慢慢跌落嚟嘅。咁可能咧係 emergency 咧係俾 IV 藥俾你食嘅。俾即係用IV 嘅藥俾你去降低你個 blood pressure 嘅，咁所以呢啲咧係全部去翻醫院嘅做嘅東西。咁所以變咗嚟講，你了解呢啲咁嘅狀況嘅時候咧，你就真係要去醫院啦。咁你可以影一張相咧，了解哇原來我有呢個情況咧，咁依家要睇醫生啦，就要去入醫院咧係急症室啦。因為高血壓咧過咗180咧，其實呢度慢慢高上去好大問題嘅。個問題喺邊度啊？第時中風啊，你呢個是大劑，因為中風咧你就會係個人咧係個即係痊愈後咧，你 cost 都好高，同埋生活係好差嘅。OK，so important if you have really hypertension over 180, you gotta go to ER. You have to emergency take care, make sure you are really taking care of.Because many of my patients who come in with 200 and up, they also have stroke. And if stroke, if you have not be there within like 45 minutes after with their stroke time, the chances of you really brain damage is extremely high. So you want to make sure that go to ER before you even get to that part. So just lower your blood pressure because you never know.How your brain vessels are really, any capillary are really, really good. If you have burst certain area and continue to bleed, that's where you're going to have a problem with a stroke. And we talked about it before, and you got to understand stroke is a very expensive healthcare, plus it's extremely difficult after you recover. So if people are diabetic, what's going to happen?Now, with people with diabetic, as you see, stage 1 and stage 2. Stage 1 is cholesterol goes up, mixed with the blood, the sugar, and then you become very thick and plug everywhere. Your blood pressure goes up. So usually, but many of the 70% of the diabetes will have actually hypertension. Okay, and this is with this you have a risk of what? Your risk of cardiovascular issue, your risk of kidney issue, and you have risk of stroke, right? So all these, you have to manage your blood pressure. You cannot just ignore it. So problem with pre-diabetic is the same thing because pre-diabetic, as you know, remember the stage 1, stage 2, moving to stage 3, you all have that hypertension before you move to pre-diabetic. So you also develop risk through high blood pressure, and which ultimately leading you to the pre-diabetic, eventual diabetes. So you gotta manage. You don't manage, you will definitely become a pre-diabetic diabetes. So you want to make sure that you're aware of that with people with diabetes, so you can start doing this, taking skills to manage this situation. 嗱，其實糖尿患病者咧，佢要注重嘅原因咧，就係因為大多數糖尿病70%都有血壓高嘅，記唔記得 ？Stage 1， 我血糖高上去嘅時候咧，我嘅膽固醇都高啦，咁就將全身嘅東西去 Stage 2就塞啦，咁血壓就可以上升啦。咁有少話前期患病咧，一帶落去咧就一定血壓高咗先嘅喎。咁70%一定有呢個情況發生。咁所以變咗咧，當你係如果你糖尿病咧，多數咧你要 manage 你膽固醇、血壓同埋糖尿嘅。呢個係3樣嘢，你多數有血壓丸、膽固醇丸同埋你嘅糖尿嘅藥。 所以其實咧，呢個係一個連貫性嘅東西。前期患病咧，雖然你未有食，但係你一定會有高血壓嘅風險喺度。咁你一定要處理，所以你一定係繼續咧係知道，哇！呢啲連繫性係點樣㗎？一定要知道。Now, a lot of people say, wow, why me? Why I have this hypertension? Why is it something I did wrong in life, whatever? Well, first of all, your age is a big cause of it. In other words, you are older, over 50 years old, your vessels are no longer as flexible as before. So your vessel before is not flexible, so the pressure inside will become higher. Because before you're flexible, you know what? Your blood pressure doesn't really goes up. But if you are not flexible, your blood pressure goes up, right? So your age will be one item. So after 50 years old, you got to start seeing yourself. You got to watch, okay? Now, secondly, also genetic. Could be your parents, your brother. They all have hypertension. So most likely, you will have hypertension also. So you can find out if your brother and sister, your parents have hypertension. You got to start watching, because that means that you will most likely have hypertension, risk in your genes, basically, okay? So another thing is lifestyle factor. In other words, you have not really managed yourself really well. You take a lot of high sodium diet, like for example, a lot of people just every day when they eat food, they don't just put pepper, they put lots of salt. And that result with that, they will definitely drive up the high blood pressure. More salt, your fluid are retained, your blood pressure will go up, okay? And when you do that, it's not healthy at all. And plus, a lot of people are lack of exercise. They don't move around, because move around, you got relaxing your blood vessels. So the blood pressures are going to be much better. Instead, when you don't move, your vessels are considered the same activity, static, and your blood pressure also may go up. So also you smoking, and then you smoke also harden vessels. Excessive alcohol is the same issue, because you drink a lot of alcohol, you also get your blood to be pumped, become, stressing everything. So you don't want to have drinking a lot. And stress is again another one, because when you stress, your blood pressure also will goes up. So these are the lifestyle issues, especially if a person that, I'm so busy, I got to work real hard. These are the people that you really got to relax yourself. If not, your blood. I have to drink a little Lowsutea. Okay. Also, you may have other chronic conditions that you also drive the blood pressure goes up. For example, diabetes, right? Remember, stage 1, stage 2, your blood pressure goes up. Now take care of it, your blood pressure will continue goes up. So diabetes is actually a very common to get diabetes. 70% will have that. Obesity, overweight is another issue. Now, what a lot of people don't realize, sleep apnea, because when you have sleep apnea, meaning you are overweight, your throat, your air pipe, the tongue always pressed down to the air pipe area, and you actually not getting air, and your blood pressure driving up, and you're not taking a sleep apnea. You can actually have stroke while you're sleeping. Wow, that's very scary. So those are things that you got to go to talk to a doctor specialized on sleep apnea. You might get a CPAP machine to sleep during nighttime to flushing air in your throat, so you don't get drive up nighttime the blood pressure of your brain, then you get a stroke, right? Kidney disease also another one. So if you have diabetes, you have 70% of a chance of kidney disease, and all that will increase the risk of the so-called part of chronic condition that drive up blood pressure. Now, some other medication also. Oral contraceptive, also decongestion, also can be raise the blood pressure. So when you take medication, make sure you understand what type of medication you take that will increase your actual blood pressure. So this are some of the cause of blood pressure, which many of you might not even understand or may not be aware. but now you are now know that that's these sinus this area you need to start focus to change to eliminate, so that way your blood pressure can be lower。嗱，各位同友，高血壓成點解會咁咧？好多時都有人都唔知道咧，原來咧高年齡啦，即係50歲以上咧，因為啲血管開始硬化，咁啲血管唔係咁 flexible 嘅時候咧，咁啲血管你血管一定會個血壓會上升嘅。咁同埋咧，仲有咧，你係呢個遺傳學裏邊啦，你 genes 啊，你係你爹哋媽咪啊、哥哥啊、你細佬啊，已經有高血壓，個 chance 由於高血壓都高嘅。嗱，生活方式好緊要嘅，即係好多人咧就冇減，即係食鹽嘅關係啦，日日食飯咧又加好多鹽啦、豉油啦，呢啲全部係高鹽嘅。咁啊，或者缺乏運動啦、食煙啦、飲酒啦，咁其實呢啲咧全部咧係會整高你血壓嘅，同埋仲有壓力，工作壓力係一個更加 common 嘅情況，即係話我工作壓力好大喎，哇，好用力啊！我成日同埋好多人咧就喺高壓裏邊咧要好嬲嘅鬧人啊，嗰啲咧就全部壓力嚟嘅，咁亦都會令到你個血壓會上升嘅。咁仲有好多慢性病啊，慢性嘅疾病，好似 for example 啦，糖尿病成日睇到啦 ，stage 1、stage 2血壓一定上升嘅喎，70% 糖尿病者都有血壓高嘅喎。咁同埋咧，仲有係肥胖啦，如果肥人咧多數血壓亦都高嘅。嗱，睡眠窒息症咧好多人都唔知嘅。因為你呢度係好肥啊，咁你個脷咧跌咗落去咧就冚咗你個 air pipe， 即係個唞氣個氣管，咁你唞唔到氣嘅時候咧，你血壓呢度係咁上升嘅喎，咁你可能 end up 就有 stroke 啦，咁同埋咧即係有中風嘅機會啦，咁同埋咧仲有腎病啦，你損壞咗腎病咧，腎功能咧你血壓一定上升嘅，一路壞嘅時候一路壞嘅時候，你血壓喺度繼續上升嘅，咁所以呢啲全部係增加血壓嘅風險。咁有時食藥物咧都有嘅壞嘅即係避孕丸啦，或者係感冒丸啦，咁呢啲咧係亦都有可能咧係會令到血壓上升嘅。所以呢啲原因咧，你就要睇下，喂有咩能夠可以做啦，或者唔好飲多酒啦，做運動啦，唔好食煙啦，咁呢就幫助你降低血壓嘅。嗱。A lot of people ask, why pre-diabetic, I will have high blood pressure. As you remember this chart, because you're pre-diabetic, most likely your cholesterol and also most likely your cholesterol and also your cholesterol and also the blood sugar add together, it becomes very thick. And so when it becomes very thick, and end up all the you start forming plaques everywhere. So end up if you have a lot of plaques, you know what? Oh wow, the space over here is very, very small. So net result, you will be basically a lot of the people will start getting high blood pressure because you see the space is coming here and everywhere, the whole body, you have less space, your blood pressure definitely goes up. So pre-diabetic has the same issue of diabetes, no different. So what you want to prevent is less of this plaque form throughout the inner wall of the vessels. Because when your inner wall of the vessel become harder, become less space, definitely you're going to have hypertension. So keep that in mind. Also, if you have high blood pressure, your diabetes is going to get worse. So make sure that it's difficult to control your diabetes. So you don't want to get yourself into the stage. So that's why it's important to control your high cholesterol and sugar so you don't even get into pre-diabetic stage, right? 嗱，糖尿病前期患病者好重要咧，真係要繼續努力咧，係幫助你咧，係唔會將啲糖加埋啲膽固醇，係整到血好極 ，form 咗呢啲咁嘅plaques 咧，咁令到咧你個血管裏邊咧個位置係好少咧，咁你就 end up 成日都會有咩啊？呢個血壓高喎，係咪？咁所以呢個咧前期患病同埋糖尿病都係一樣嘅。同埋如果你繼續係血壓高嘅時候咧，亦都令到你血糖咧好難控制，所以呢個係一個好重要嘅東西咧，大家要了解。呢度咧係就係令到你個 space 即係血管裏邊 嘅空間越整越細嘅時候咧，血壓一定上升嘅。So now you realize how you get your blood pressure up. You understand that, wow, my blood pressure could be diet, genetic, could be all my chronic issue that come on because of diabetes. Well, how do you resolve that basically, okay? How do you really continue to manage and solve my problem, diabetes? Okay, one, you got to make sure, continue to manage the diabetic, manage your blood pressure. You got to have a good lifestyle change. And that is the one of the major thing, first step, you got to control your lifestyle change. If you can able to control lifestyle change, then you are really going to be higher, much higher chances of success, control your blood pressure, okay? So what's that mean, lifestyle change? First of all, your healthy diet is so important. So very important, you got to start, make sure you got to be able to cut down the salt on your diet. So not a lot of soy sauce, not a lot of salt in your diet. Like for example, when you go to eat, don't get your salt shaker and just keep doing this. There's a lot of times it's just a habit for years. So your diet has to be low salt. And you got to take a lot more fruits like apple, eating the skin, vegetable, whole grain, lean protein, like, fish, like eat a lot of salmon, and no chicken skin, mainly the chicken, meat, white meat, and also make sure lean beef. All these will help you to base your diet to make sure with that you can lower your blood pressure. So that's important. First, control diet through lifestyle. Now, secondly, your weight is also important. As I mentioned, if your weight over BMI over 30, you just minus 10% of your weight, you can lower your A1C, and your blood pressure, you actually will definitely improve about 10 points, meaning that you'll be 130, now you could be 120. So that is very important. Lower your weight. Now, excess weight, your blood pressure definitely will go up. But losing weight, you will find that you are much more movable. When you're movable, you do more exercise. You know what? Your blood pressure also going to come down. So weight is also very important. 嗱，各位朋友，好重要，好重要，記住，當我血壓高嘅時候，重要點咧就係我生活習慣咧就一定要改變，然後咧我先至血壓咧就會降低嘅。咁你覺得咩叫生活習慣改變啊？第一，健康飲食咧係好重要嘅，我就唔可以繼續食好多鹽啦，亦都唔可以話哇煮嘢落多啲豉油啦，呢個全部唔正仔，係淡嘅東西，冇咁多鹽，因為鹽咧係對身體咧。即係 retain 咗啲水喺血嗰啲水喺血裏邊咧，繼續上升咧，血壓一定高嘅。咁你食多啲水果喎，咁水果食多啲蘋果啊，有埋即係皮一齊食啦。咁同埋食多啲蔬菜啦、穀物嘅東西啊、瘦肉啊、蛋白啊，食多啲魚啦。咁呢啲咧全部係幫助降低個血壓嘅。咁同埋仲有咧，保持健康嘅重磅喎。因為如果我係 BMI 過30咧，我真係要講減磅啦。咁點減啊？你做 exercise 啊，食少啲呢啲高卡路里嘅東西啦。咁啲咧超磅減磅咧，譬如你係減10% 磅咧，你 A1C 跌1%，你個血壓咧 most likely 都會跌10個 point 嘅。即係話我原本係140，如果減咗磅之後咧，你會130，100再減10%咧，減130會減到120。哇，好正喎！即係呢個咧全部係幫助咧係降低個血壓嘅程序嘅。Now, I already mentioned you gotta exercise. If you don't exercise, you are not gonna get yourself lower your blood pressure. So what can exercise do? Very easy. Actually, you can walk. Just walk. You can walk 10,000 steps a day, or start up with 5,000 or 3,000 first, and move up to 5,000, 6,000, 7,000, all the way 10,000. Now, if you cannot walk, you can also go cycling. You buy a cycling machine, or you can buy a simple walk master, which is right now $50 you get one, and you can able to walk up and down as long as you keep moving. When you walk, you also move your hand this way too. So that way is also good for your heart. Plus, you can also do swimming. Swimming is a very good exercise, especially when elderly, your joints are not so good. All that will able to help you to improve overall health, heart health, and also help you to lower your blood pressure. If you are a smoker, you gotta quit, because smoking has been proven actually will be increase your blood pressure. If you quit smoking, data also show it will decrease your blood pressure. Plus, you eliminate all the excess, health issue like lung cancer, all good stuff. So you gotta quit smoking. Now, limit your alcohol consumption, especially whiskey and all stuff. Okay, or red wine, yeah, you can drink 1 glass of red wine, no problem, or half a glass, but keep it limited amount. One of the things that a lot of people don't realize, stress increase your blood pressure. If your work is really hard, you got to practice a little more relaxation on your stress. Like, for example, you're going to have meditation, do some more deep breathing, and exercise will help to lower your blood pressure. And also will give you the overall being to feel good. Sorry, I'm going to take some. So very important, you got to manage your stress. Because if you are able to manage stress, your blood pressure keep going down. Now, if you continue to 140 and up, you might need medication. And let's face it, because all the things you do, you might, if you're early stage of hypertension, you're 140, do all that, you might be able to really lower back to 130 and below to 120. But if you are 160, 150, really at the end of the day, if you don't have medication, it might not able to help you all the way to drop it down to 130, 120. So you got to work with a doctor, because now most likely you have a chronic or severe hypertension that definitely medication is required. So you got to talk with the doctor to find out about that. So make sure you are supported with medication. 嗱，各位朋友，其實咧喺呢個高血壓裏邊咧，好重要咧就一定要運動。嗱，如果你行到咧，或者一日做1萬步啊，或者係做啲就算做開始肩步、肩步一路落上1萬步咧，係會好大幫助咧，你降低咗你血壓嘅。同埋咧，如果你話走唔到，我有膝頭痛，游水都得嘅喎，咁所以最緊要係喐。喐咧最緊要喐埋呢隻手，因為喐埋呢隻手嘅時候咧，你對個心臟好咗嘅。咁呢個咧就會降低你血壓啦，亦都降低即係幫助你身體成個身體喐到啦 ，circulation 好啦，心臟病都可能少咗嘅。一定戒煙，戒煙咧係好重要嘅，因為如果戒煙咧，你係會 increase 咗你血壓嘅。戒咗煙咧 ，study 咧 show 到咧全部都血壓會降低嘅。飲酒多數係如果飲熱酒更加有問題。如果你每日飲一杯酒 ，OK， 或者半杯酒更加好冇飲多。咁同埋咧，有一樣好多人唔知咧，工作壓力大咧係一個好大問題嘅，因為工作壓力大係令到好多人咧就會個血壓會上升。咁仲有啦，好重要咧，其實如果你有慢性嘅問題啦，好似係你嘅腎病嘅問題啊，或者你嘅其他嘅問題咧，你血壓係好高嘅，咁你咧就真係要仲有靠藥嘅。如果你係即係現在已經係140度或者130度咧，可能咧 exercise 啊、戒煙啊、戒酒啦，可以降翻去130、120。但係當你高過太高咧，藥物係好重要嘅。咁你一定要同醫生傾下，喂，有咩藥物幫助我咧，係降低我血壓咧？ Now, don't forget to drink Lowsutea, because Lowsutea actually is a natural herbal tea. Basically, it's not a medication, but it really supports your blood pressure. Because what happened is it actually dump out the salt in from your urine, and so that result, if it's less salt, your blood pressure will come down. Plus, you also remove your sugar. So all that continue with lower sugar, lower cholesterol, and a lower salt, your blood pressure will come down. It's 100% natural. You drink a little more, it's okay. Every day, make sure you drink 2 liters of Lowsutea with 2 bags, right? So with that, it will definitely help you to lower your blood pressure and also at the same time lower your blood sugar and lower your cholesterol. Wow, that will be a wonderful things to do, okay? 嗱，唔好唔記得飲去糖茶，因為去糖茶係真係幫助你咧降低血糖嘅。點解咧？佢將個嘅鹽咧喺個尿度掉咗出嚟，咁掉咗出嚟嘅時候咧，你個血壓咧就會降低嘅。咁當然啦，佢亦都降低咗你糖分啦，降低咗你嘅膽固醇啦，同埋你血壓亦都會降低。咁呢個係一個好重要嘅東西嚟嘅。咁所以變咗咧，繼續飲血糖茶係好有幫助嘅，同埋呢個係一個唔係一樣，一個係一個即係 natural 嘅產品，係即係一個有番石榴就苦瓜。咁邊樣嚟講咧？你飲多啲都唔怕嘅，係繼續係幫助你降低你個血壓嘅啫。So really, you can see Lowsutea can give you a really different health journey. Combining with Lowsutea, you can actually start learning about dieting. You can start learning about how to make a healthy lifestyle through our education. And on top of that, when you start changing your lifestyle, you have a much better chance to support your overall health, to lower your blood sugar, lower your cholesterol, lower your blood pressure. So the 3 high, you are basically resolvable, meaning that blood pressure, cholesterol, and sugar are being better managed. So you got to really have this. Now you associate with all 3. How did it happen? And you have a better understanding. So you can also, if you lower your blood pressure in the early stage, lower cholesterol early stage, remember stage 1, stage 2, now you can even prevent yourself going to a pre-diabetic stage. So isn't that wonderful? Decrease your risk of pre-diabetic, also decrease the risk of diabetic complication. But even though you are pre-diabetic already, no problem, because if you lower the 2 with the blood sugar, maybe you will never go to diabetes either, because you will have an A1C less than 5.7. Isn't that wonderful? But if you get diabetes, no problem. We'll help you to lower this pack to lower than 6.4. So continue to be healthy. So very important. You can now see we can help you to lower your 3 high, continue to change your lifestyle, manage yourself. Now you can be a much better and healthier person as you move on. 嗱，各位朋友，你而家睇到啦，去糖茶咧係幫助你咧係改變咗你生活，因為你聽到我講咗好多書啦，喺 diet 上啊、磅數上啊，同埋你嘅身體嘅能夠飲咗去糖茶咧，係降低你嘅血糖啊、膽固醇啊，同埋你嘅血壓啦。咁你3樣咧，你都減到嘅。咁當你減咗之後咧，你生活習慣已經係習慣咗啊。咁你成個生活咧，你都係覺得哇係喎好喎，我依家變咗一個健康生活啦。食嘢我又知道食咩好啦，會講 increase 個 cholesterol 同糖嘅，即係變咗我食好多生果啦、谷嗰東西紅米啦，我食多魚啦要好啦。咁我仲有咩啊 ？exercise 喎，我又知道 exercise， 咁亦都將啲血管咧會硬化啦。血管係泵得好啲啦，咁血壓又會降低啦。咁仲話啦，我磅數降低咗咧，我血壓直情都會降低喎。咁飲咗血糖茶咧，會降低3高喎，血糖降低、膽固醇降低、血壓亦都降低。哇！咁你就身體咧十分健康。咁如果你已經係血壓上升嘅，或者膽固醇上升嘅，當你減低咗咧，你連前期患病都唔會去。亦都如果你係前期患病嘅，你可以轉翻去普通人一樣冇問題，唔會前期患病。就算你係糖尿病患者，你因為轉咗你 lifestyle 做晒呢啲東西咧 ，guess what？ 你要落到去前期患病嘅 stage， 咁你身體一定感覺係好健康㗎啦。咁你變咗嚟講咧，你就冇咗所有嘅 糖尿病嘅併發症嘅發展。咁所以咧，今日 so today is good to help you all understand really at the end of the day how to manage your blood pressure, so you can, especially people are pre-diabetic diabetes, so you want to make sure that if that is well managed, the chances for you become more risk in the sense of health risk or complication are severely decreased, especially in places of heart disease, stroke, and also kidney failure, because you are well controlled your blood pressure, your blood sugar, that you really become less chances of this risk to become all these major diabetic complications. If you are pre-diabetic, if you are controlled that, you will never get in there. So that's why it's so important you can follow through this lifestyle change, continue manage your pre-diabetic, to not go to diabetes, and hopefully you will change yourself back to a normal person, and that will be wonderful for you to continue to maintain this stage. 嗱，今日了解係血壓，你知啦，第一個 stage 咧，如果你血壓係控制到，膽固醇控制到咧 ，guess what？ 你個前期患病都唔會去呢度。就算依家前期患病咧，你可能跌翻去，直情做一個普通人，你 A1C 係0.7嘅。咁所以變咗做咗呢樣嘅時候，你永遠去唔到呢個前期患病，去到糖尿病嘅有糖尿病嘅風險，好似血壓高啦、心臟病啦、中風啦、腎病啦，呢啲嚴重嘅問題咧，全部係拆除咗佢。咁所以變咧係幫助你咧繼續係身體健康，所以能夠令到你咧係管理到你自己咧，會變咗一個糖尿病人或者係前期患病人，變咗你冇咗糖尿病嘅風險。Now, in a way, you gotta continue monitor your blood pressure, and you gotta able to also make a lifestyle change. Now, by the way, to monitor blood pressure, how do you monitor? Each morning before you wake up, just wake up, you have to measure one time blood pressure. See whether it's 120 or 80, and then and you should at least rest it 20 minutes before you measure. Don't wake up and boom. A lot of activity, you measure, your blood pressure goes up. If you can, in the afternoon, it's good to measure one time. And then also before you go to sleep, and you always have 20-minute resting before you take the blood pressure. And best to record it, write it down. So that way you can able to see the trend of blood pressure is going up or not. With that, if you measure, you also get your eating a healthy diet, maintain your weight, and then you also have a lot of exercise and regular physical activities. All that will help you to lower your blood pressure, and then you can actually have support it if you are really high or getting to be high. Doctor will give medication, so make sure you take your medication. So all that, and also drink Lowsutea, will really support you overall health and decrease the chances of high blood pressure. Will be tremendous benefit to your whole body. If you are already a chronic high blood pressure person, please do not forget your medication, because a lot of people, when I was ICU, some of the old folks, they're 60, 70 years old, because they're old, they forget the medication. Within a week, forget the medication, blood pressure can go as high as 300, and they get stroke, and they come to the hospital. So I already took care of a lot of these patients. So it is not a good thing if you forget medication. So medication is important. Tell your children, hey, I'm taking hypertension medication, remind me to take it. So make sure that you will continue to do that. 嗱，每日你一定要度血壓嘅，咁朝頭早度一次血壓啦，係啱起身後，如果20分鐘，你起身20分鐘後咧就 rest 咗啦，咁你就度血壓，睇下朝頭早血壓係咩啦，就千祈唔好係做咗好多嘢之後先度喎，咁嗰陣時就唔準嘅，因為咧血壓會上升嘅 ，OK？ 咁當你晏晝嘅時候，亦都係平心靜氣嘅時候咧，再度一次，然後最緊要係夜晚嗰陣時咧，瞓覺嘅時候又度一次。 每一次度啫有20分鐘休息嘅時候先度。咁變咗咧血壓咧就寫低佢，咁你就知道你個 trend 係點啦，係同埋知道你個血壓點。仲有食物同埋所有嘅食材啊、保健身體嘅重磅啊、運動啊，呢啲嘢全部幫助你降低血壓嘅，同埋咧亦都減低你個幾個中風嘅風險啦，同埋咧亦都知道你如果你控低血壓咧，你即係 stroke 同埋即係中風嘅個大步降低。咁記住飲去糖茶，因為去糖茶係降低三高嘅，咁亦都支持你整體身體健康啦。So for people who are diabetic, pre-diabetic, you got to work really hard with your healthcare provider to develop a personalized how to manage your whole blood pressure, your blood sugar. All that has to part of your program for yourself, talking to the doctors. Now, they might give you actual medication. That's okay. But you got to remember, take the medication. As I mentioned to you, some of the people who did not take the medication, elderly folks, the blood pressure go as high as 300 and they get stroke. And they end up really tremendous problem of stroke. They can die. Health care costs tremendous high. So that is so important because you have to continue to monitor the blood pressure because of the fact that the only way you can tell is by getting the bumpy cuff, pump out blood pressure, find out how high is the blood pressure. So when you have that, manage, write it down, then now you are continue to show this to your doctor, say, hey, my blood pressure is this. So whether you need medication, but on the same time, you already start changing your lifestyle. So the chances of you to get lots of medication may be less. But if you don't do the exercise, don't do the diet, don't do the weight control, and don't lower your weight, guess what? Your blood pressure will continue to go up, blood sugar will continue to go up, cholesterol will continue to go up. And that will lead yourself to pre-diabetic, diabetes, and that's something that you don't want to go. That's the time that you will be really feel sorry a few years later. You have all sort of diabetic complication, which I don't want to see you guys at that stage. 嗱，各位朋友，記住，當你有糖尿病病者或者持久患病者咧，你要注重咧係唔淨止係膽固醇啦、糖啦，仲要一個係血壓。血壓控制咧，你一定要度嘅，要知道幾多先控制到嘅，同埋咧仲要每日要度3次嘅。最低限度啊，第一次就係起身前啦，即係啱起身冇幾耐啦，20分鐘咧裏邊咧就要度血壓啦。第二次咧就晏晝坐低定就度啦，然後夜晚咧去度。咁呢個好簡單嘅度血壓就，係咪？但係一定要監控，要寫低佢嘅。咁當然啦，度血壓之後咧，你嘅 lifestyle change 啦，要食嘅嘢啊、exercise 啊、磅啊，呢啲全部都 part 入呢個 program。咁你同醫生講咗話，如果血壓上升嘅，你話俾醫生喂，我依家血壓上升咗，需要食藥啊。當然咧，你轉咗一個 lifestyle 咧，多數藥咧唔使食咁多嘅，可以嚇。咁但係咧，有陣時咧，你係真係要食藥先降得低嘅，因為你已經係 damage 咗嘅，你血管係 damage 咗嘅。如果 damage 咗，即係話啲血管硬化晒咧，咁你係翻唔到轉頭噶嘛。咁你真係要藥嘅控制噶咯。咁呢樣嘢咧係要了解係咁嘅，咁一定要揾醫生幫助係去做到呢樣嘢啦。咁所以，但係最重要係改善咗你整體嘅身體健康，因為你已經係 lifestyle change 咗嘛，咁啊更加係健康，咁你更加係做完之後咧係可以做到長命百歲嘅。OK，今日嘅講座咧就係咁多啦。咁我問下各位有冇其他嘅問題啦。So today we have ended my seminar. I hope that everybody will really can able to have a better understanding what is hypertension and what can be a risk for you. So really important to start learning how to change your lifestyle. It's important. If you have questions, you can write to us. And very important, you can write to us. And also, you can send us a note or even give us a call. And we can reach by Facebook and also You can say the email address that sells Lowsutea. We can help you to answer question. You can take a picture of this. So this is what we can help you with. So I hope you can really able to start understand what is hypertension. Hopefully with that you can able to control your blood pressure. And if you have a question, do write to me. I'd love to help you out, answer any question, or even give me a call. The phone number here, Hong Kong is 2816-2388. US, you can, if you're US, you can also call this number 773-273-8082. I would love to answer your questions. OK， 各位朋友記住，如果你有問題咧，隨打電話俾我，或者寫個WhatsApp 俾我啊，或者係寫 email 俾我啊，或者打電話俾我啊，咁我希望咧能夠係 answer 你啲問題嘅，所以唔緊要嘅問啦，我哋係好樂意係幫你問呢啲問題出現。OK，all right good。咁如果冇問題咧，咁我哋就會係呢個希望各位有一個愉快嘅星期六。OK，so thank you for watching and thank you for listening. I hope you have a wonderful weekend. Thank you very much. Have a good day. Thank you. Bye bye.